This is a conversation which I think might help you if you are post an injury or post surgery that affects your mobility. So I have some direct experience of this because a few years ago I fell through a window, severed a tendon, and then 6 months later had surgery on it that left me very immobilised. And by very, I mean I couldn't get to the toilet on my own for at least 2 weeks, and really struggled actually for a lot longer than that. So I can talk about this with a lot of experience. Now, first things first, what I should say is you may not know at this point how your mobility is going to be affected if you're waiting for surgery or if you have just injured yourself. But I think it's really important to think about some of the practicalities that are going to affect your life in the coming weeks. Hopefully not very, very long, but even a week without these kind of things is not a nice week and could lead to issues. That's the other thing that's very important. It's not just that it's unpleasant, it's also could lead to further problems. So let's start with one of the most basic practicalities that all of us have to do every day, which is go to the toilet. So as I say, for myself, I couldn't get to the loo on my own, even though I had a bed downstairs and we've got a downstairs toilet, which does have a shower in it, but moving around at all was very, very difficult for me. I couldn't put any weight on one foot, and especially in the middle of the night, half asleep, there's a little step to get down. I suspect even if there hadn't been, I don't think I'd have been that good in the middle of the night negotiating. I was feeling quite unwell, I was in a lot of pain, I was waking up a lot. And so the first purchase, we thought we were super prepared before I went into hospital. We knew this surgery was coming for about a week. And it's like, oh, we've got a bed downstairs, we've got this toilet, it'll be fine. I'd practiced on crutches when I was well. It's just totally different. And not that I was amazing at that anyway, but it's really different because I was feeling good and then I was not feeling good. And so after the first hellish night when I had to wake my husband up time and time again because I was in a lot of pain, so I kept on waking up, I kept on needing the toilet, I couldn't really sleep, and then every time I needed the loo I'd hang on and it was awful, and I was trying to not drink too much water, but that is also very bad for you and gives you urine infections. And then that next morning we were like, let's order a commode. And that's exactly what we did. And it's not the most romantic purchase you've ever made, but I don't think I have ever been happier about something arriving in my house, because that next night when it had arrived, I did not have to disturb Rich. I didn't need to disturb anybody. I barely needed to wake up. I could easily, on one leg, transfer myself to it next to my bed and literally have a wee, put the lid on, and then bless Rich, he emptied it the next morning. Fine, absolutely fine. So already quality of life much improved. And what I would say as well is that, okay, let's say I could have just about got to the toilet, or I didn't mind waking Richard, both of which weren't true in my case. Also, you can sometimes be endangering yourself further. If your balance isn't that great, if your mobility is not that great, if you're not feeling that well, sometimes having a really easy way to go to the toilet where you're not going to hurt yourself matters, and get one that's sturdy. You might be able to get one from the hospital that you're at, potentially, if they also think it's important. But often hospitals are very keen to get you out the door. They're very, very busy, and they don't necessarily want to invest that many resources. So how they might assess things might not be as close to reality as you might like them to be. Another thing that's really useful, I have put a link down to these because I noticed they've got them on TikTok Shop, is these water wipes. I found these incredible. It's because they're 99.9% water. So that for me at least, there was nothing that irritated my skin. And I used those to clean myself when I've gone to the toilet. And I mean, I'm somebody who likes to do that every time I go to the loo ever. That's in any part of life. And so this really helped because it wasn't possible to have a shower every time I went to the loo. And it's very important to keep up as good hygiene as you possibly can, which brings me on to my second point actually, which if you're lucky enough to have maybe a shower that's accessible, perhaps with a toilet that you can sit on so that you can shower, that is amazing. Otherwise, you're going to want to invest in some little things like this, to have bed baths, and also the water wipes that I've mentioned already. This might be more for your private areas, and this may be more for and you do your best you can with these, but it's not going to be the same as having a shower, and you're not going to wash your hair and stuff like that. I have to say, for me, the greatest pleasure of my life for about 3 months was being able to have a shower every day. One thing as well, and the hospital will give you one of these, but you can also order them on Amazon if you have got a limb that has been broken. And actually, I'll just show you on my arm, because this is too big for an arm, this is for a leg. But if you've broken your arm, what happens is you put the cast in, and obviously the leg is much bigger than your arm, so that is tight around your leg. And obviously you've got to make sure it fits you, but I would put this on my leg over the cast so that I could have a shower. If your cast is too big for these malarkeys, which it might be, this isn't that big, and obviously this has got to be tight, and if it's not tight, do not use it. I found a really great YouTube video with a girl using 2 bin bags, some little towels like this, an exercise band and some masking tape, and it worked, because the first cast I had, I couldn't fit this over it, but me and my sister worked out how to do this, like, you know, thing with the bin bags, etc. And I'm not joking, not a drop of water went on my cast. So, and it was a godsend, because it's so nice to be able to wash. But if not, you're gonna have to find some other way, and that's really important, because otherwise you could easily end up with urine infection or other problems. The last thing you want when you've just had surgery or had an injury. And then the other thing I would say is, if you are able to get to the toilet, let's say your toilet is incredibly easy to get to and you're quite confident on crutches and you're not someone who pees a lot in the night, you can get these like frames for the toilet that kind of go over the toilet, and it's got like a raised seat and it's got little arms. That means you can kind of push yourself on and off the toilet really easily. And that might also be useful if you can actually get to the loo, or once you can get to the loo, but just giving you a lot more. I mean, some people, you know, get up and down on one leg or whatever, but might be both legs you've got a problem with, or something else. But certainly for a lot of us, that is really helpful to be able to use your arms as well in that situation. So really stable, and also the toilet seat being higher also makes it easier. So all of that, very, very helpful. And some of this, one would hope that an occupational therapist would tell you about the hospital, but literally I just had a physio come and give me a pair of crutches I couldn't use and say, yeah, you'll be fine, bye. It's like, okay, I'm so glad that we are prepared. And, you know, I'm hoping that they do a better job with old people, but I'm not sure they have time to. So this is why I'm making this video. Other thing you want to consider is how you're going to get back into the house. Now, that might not be any consideration for you. For us, we've got steps on the way up, but what we have got is an entry with no steps. So you want to think about how you're going to get home from the hospital. What I found is that Uber XLs have got really high seats, so that's quite easy to manoeuvre yourself in and out of, potentially, if you can't kind of sit in a really low seat. The practicalities, I know, it's untrue, isn't it? And you also want to be thinking about getting your shopping delivered. All supermarkets do that, and making it as easy as possible. I mean, if you live on your own, you're going to need really simple food. What I would say, I found that Ocado and Iceland seem to be the better deliveries, where they do bring a bag and they're really happy to bring it into the kitchen for you if you ask nicely. Other ones like Waitrose throw it on the doorstep, not even in bags, and you're just like, well, if you're disabled, forget it. I don't know maybe they're nicer to you if, you know, I mean, my husband would be taking delivery of stuff, but yeah, we did not find that so useful. But there are some really good delivery services from supermarkets, and then just planning a really super healthy menu, but that doesn't take too much preparation. So I hope all of this helps. If you are facing a period of immobility, I wish you all the best. It can wear on your patience, but I think having these practicalities in place is going to help you so much. And the one thing you can always do is pick up the phone and chat to people. So make sure you do that, even if it's difficult to do very much else, to have social contact outside your immediate family. Pick up the phone and talk to people. I think that's going to make all the difference as well. Wishing you well for a speedy recovery.